Good day, everyone. Today is Wednesday. It is a wonderful, beautiful Wednesday, and I hope you're enjoying your day. So, Nclex, what, when, where Wednesday? What should you study this Wednesday? How about reduction of risk potential? And what should you do as a nurse? You need to provide your patient with safety. You need to make sure your patient is safe. So, in reduction of risk potential, you're usually trying to reduce the risk of a complication by recognizing that there is a complication or maybe that there is a problem you need to fix. Those are nursing actions. What do? We fix problems, we prevent problems, we help the patient in some form or fashion, and we provide safety. Now, the priority in that is as a nursing action, you're going to take care of ABC if that is a problem. You're going to take care of patient needs that are priority within Maslow's hierarchy of needs. So physiological needs come first, safety, and then psychosocial. All right. And then ADPI, you may need to assess first so you can recognize a potential problem. But if you don't see any of those things within your way to prioritize reduction of risk, how to prioritize reducing the risk of a problem, then go to safety. Find something that is going to keep your patient safe. All right, so safety is going to be a priority. So I hope you are enjoying this wonderful Wednesday. I am enjoying it. I'm taking time off for my birthday week. It's my birthday week, and so I hope everyone's enjoying it. I've had a wonderful, wonderful, great news today. One of our students passed their NCLEX RN exam, so hopefully next week we will have a webinar next Saturday on the 16th. So stay tuned so you can know how to join the webinar. So those are some key notes. Be sure to take notes, write down the test taking tips that I just mentioned, and we're going to look at a question. This was previously recorded, a question on reduction of risk potential. So just remember that when you're reducing the risk of a patient problem, you may need to educate or reinforce teaching if you're the LPN to patients about their procedures, or you may need to prevent or reduce the likelihood of a complication occurring during a procedure. All right, so let's get our patient ready for their procedure. Let's look at this question coming up next. Have a wonderful day, guys. Hope you enjoy the video. All right, so we'll do this question. We get one more opportunity. This one, I just want you to give me the answer. So, 1, 2, 3, or 4. I don't know why it's 1, 2, 3, or 4 on this one. And just think about what your answer would be. This is a little bit shorter, so we're going to reset it, and I'm going to start 2 minutes. We'll go over a little bit. All right, go ahead and start now. We have 2 minutes. And just put in the chat what your answer will be. And if anyone can tell me also what's your testing strategy, I will give you a free lesson for that. All right, so this question is actually one of the top reduction of risk questions that I see people miss. And it's from a practice exam. So it's at the end. A lot of people miss this question. All right, and I think out of like 20 something people, maybe 4 got it right. So it's very, very highly missed. All right, so what is the priority? Okay, so if you said priority, you're going to prioritize. That is a strategy you can use. All right, so according to your decision tree, priority tells me that I might need to use ABC if ABC is a problem, or I could use, let me just go down a little bit. So ABC, oh, that's a little too small. Maslow's or ADPI. All right, so we're taking care of a child in they're 4-month-old and they're getting ready to have a spinal tap. We got to assist the doctor. That's our case event. We're assisting the doctor. They're getting a spine, they're doing a spinal tap, and we got to assist them on this 4-month-old child. So you're in that moment while assisting. That's your time proximity. If you, excuse me, if you said time proximity, that is also a testing strategy, because where are we? Is this after, before, during? This is kind of during. It's while we're assisting the physician with the spinal tap. That means it's currently happening. They're getting ready to do the spinal tap, or they're doing, doing the spinal tap. All right. So priority, you could use one of these. There may not be an ABC problem, but we may be able to use Maslow's or ADPI. Um, while assisting is time proximity. So that tells me, where are we in assisting the doctors? Is this after or before or during? All right, so that's another testing strategy. The physician with the spinal tap on a 4-month-old. All right, another testing strategy is nursing actions. This is my own testing strategy. This one I don't really see in books, but it is a strategy, because what are nursing actions? Nursing actions are embedded in ADPI. All right, so that takes you back to ADPI. That might be a clue. It may or may not help, but we'll see. The number one nursing action is probably to fix a problem. Well, they don't really tell us we got a problem yet, so we may just need to do something to prevent a problem. Because remember, when they're asking you about procedures, they're looking for you to do something that's going to help your patient. So you can put that in there, help the patient. And if it's a procedure that we're getting ready to do, or we are doing this procedure, well, I want to prevent a complication from happening. How do I help this doctor so this poor little 4-month-old baby doesn't have any problems, right, during this procedure? So we want to know, what can we do as a nurse to prevent the problem, because they don't give us a problem yet, but I don't want a problem to happen. Number two, keep the patient safe. All right. So if you use that testing strategy, that will help you get to the nursing action that you need to do first. Remember, priority is first. Keep the patient safe. What can I do to keep this patient safe, help this patient, this 4-month-old, and prevent a problem from occurring while I'm assisting this doctor? Not after, not way, way before, but while this doctor is doing this spinal tap. What am I going to do? All right, so nursing action. So those were the testing strategies you want to focus on for this question. It needs to be a nursing action. Time proximity plays a part. Um, ADPI, assess, diagnose, plan. More so for nursing action in this case is going to be Maslow's, because in Maslow's need, safety, we have physical needs, physio, but we also have safety. And safety plays a part in your nursing actions. And she mentioned that in the way that she was strategizing for answers to the question. She said, I'd go, if in anything, I'd go with what's safe. Go with what keeps your patient safe. So safety is a big thing. All right, anything psychosocial, usually I will eliminate those right off, unless the whole question is a psych question. Because priority, remember, is not psychosocial 9 times out of 10, unless the whole thing is psych. All right. So when you went through your process of elimination, support is psychosocial. So that should be the first one you get rid of, because that's psych. Psych is not priority. Instructions. All right. If you were thinking two was an answer, two is giving instructions to the parents about the procedure. Am I going to do that while I'm helping this doctor do the spinal tap? Nope. Am I going to support this child psychosocially while? Now, you can do that kind of during, but your focus is going to be on probably physical needs or safety, because psychosocial, supporting the child, is really psychosocial. All right. So yeah, somebody went back and said one. Yes, one is going to be it. So we should get rid of instructions, because this will be done before. Remember, your time proximity is while we're getting ready to do this procedure. I don't have time to start talking about these instructions. All right. So yeah, go with your first mind. That's okay. Go with your first mind. If that's the one you want to pick, if you pick that one, that would have gotten you to a correct answer and a free tutor session. So why would we get rid of four? No one chose four, but elevate the head of the bed. If I thought this was going to be an airway or breathing problem or circulation problem, I might need to do that. But for the spinal tap, You want to get the child in a position where the doctor can get to the spine, and that the poor little 4 month old, remember, this is a baby. It's not like an adult and we can tell them to just be still. This is a little 4 month old baby. They're going to be moving, thrashing. So safety is going to play a big part. So that is also, even if you said the age of the child, I would give you credit, because that's a good testing strategy. Age, when they give me the age of a child, I think of, because adults, we usually don't have to restrain. If we're restraining an adult, it's because they're going crazy on us. They're going, acting up, and that's our last resort. But for a child, we may have to restrain them for safety, so that this procedure can be done, so the spinal tap can be done. Because we can't tell them to hold still. They didn't mention what sedative they've given or if they've given any. All right, so elevate the head of the bed. Although that sound like it could be airway breathing, the main thing we need to do first, priority is first, is restrain the child. That's the first thing. Teaching should be done before the procedure and maybe after. Maybe after, we'll teach the parents what to look for complications, or the position the baby need to be in, or what the doctor, said as far as instructions after the procedure. We'll also instruct them, teach them before the procedure. That's what we would do before. So your strategy should really be focused on priority, time proximity, nursing actions. Remember, what can you do to help your patient to prevent a problem? Keep the patient safe. If they don't give you a problem, then I'm probably trying to prevent a problem. Or what will help this patient while he's doing the spinal tap? Keeping that poor baby still. That's it. Any questions on that one? That was a good question. This is like a top miss question. I see people miss this one all the time. So it gets you really, really thinking about using the strategy, because all of them sound like good things. They're all things that we may end up doing, but what is priority and when are we doing this? Is it during, after, before? That's a good thought. Any other questions on this one? And a lot of times we'll see restrain and we'll think, oh, I can't restrain the patient first. But think about the case event. In most cases, yes, I probably would say I'm not going to restrain the child, but why do I need to restrain him? He's getting ready to do a spinal tap. This is during the procedure. I don't want that little baby to move. I don't want the doctor to stick the wrong area because the baby went flailing everywhere. This is a 4 month old. So the age made a difference, and the time proximity made a difference on whether or not restraining the child is appropriate, because they know that we don't want to pick restraints because we don't restrain our patients. But typically, when you see questions like that, most of the time they're adults. Most of the time, it's adults. You don't hardly see a lot about restraining for the 4 month old. But if you remember a question about a IV, there was an IV, and it said something about the child needed a arm board to keep them from bending their arm. That's kind of a restraint. It's not holding their arm down restraint, but it is keeping them from bending. So you may have to put that arm board on. The reason why they don't consider it a restraint, because we're not tying their arm down, but you might have to, you know, do that so they don't bend their arm. All right. Any other questions on that? Good, good, good. So these were tough. These were tough ones. Rationales. We want to the safest. Remember, she said safety. And I was like, wow, she mentioned safety, and it was like she was reading my mind. Safety, safest objective is to prevent trauma to the child during the procedure. So the child must be restrained. We're going to do option two prior. What was to instruct the patient, instruct the parents, let them know that before, when we're getting the consent, because they're going to have to get a consent for that procedure. Option three should be done before and or after, which was support. Support, because really during the procedure, you're focusing on keeping that child safe, or maybe running vitals or things like that. You're really focusing on the child. So three, support, which is psychosocial, could be done before and after. Four would not expose the spinal column, because you're just going to be sitting them up. So remember, when we're doing spinal stuff, a lot of times they have to be over like this, over the table or something, or where the spinal area can be exposed, and it opens up the spinal column. Let's see, of a 4 month old, this should be old, necessary for the procedure to be performed.